name's Matt O'Donnell. I'm the board certified surgeon at Evolution Veterinary Specialists. We at the surgery department will handle all sorts of different types of surgeries. We are a very close-knit team that is not supervised by a corporation. We are at liberty to make the best recommendations that we can for pets and to carry those out. We are very close with our patients and our clients. We have an excellent mix of cutting-edge technology, but also grassroots caring for the animals. We do employ all of the newest equipment in terms of orthopedics, plate systems, and such, as well as on the soft tissue side of things like the ligature vessel sealer. We offer minimally invasive surgery, both in terms of joint explorations, but also for laparoscopy or evaluation of intra-abdominal cases, and thoracoscopy, which is exploration of the inside of the chest. We definitely will see some cases occasionally that come through our emergency department that can't wait for scheduled surgeries, in which case they will typically call me after hours and we'll discuss the cases. And if the patient needs to go to surgery, we'll take it as soon as we can, as soon as the patient's stabilized, and go and try and correct whatever needs to be fixed. Sometimes we'll see some trauma cases. Very often it's foreign body surgeries. So if a pet's eaten something that maybe they shouldn't have, now have an obstruction. We definitely can see some cases where we have bleeding within the abdomen that may be related to prior surgery done elsewhere, or potentially a mass that might be bleeding in the belly. Likewise, we can see some cases of problems in the chest, so lung lobe torsions or lung lobes that get twisted on themselves and need to be removed. We can see really bad cases of pneumonia that the lung lobe starts to develop an abscess and starting to extend the rest of the chest, all sorts of different things. So on the intake side, the emergency doctors and technicians will give your patient a very thorough evaluation. They'll help you to understand what's wrong with your dog, or if we don't know what's wrong with it, what diagnostics may help us to determine that. And then once we have a diagnosis, they will sit down and go through treatment options with you, which may be medical, maybe surgical, or maybe both, and then talk to you a little bit more about prognosis and what to expect afterward. And that's typically where the surgery service will step in terms of surgical cases, to let you know exactly what we'd recommend doing, and then what that means for you at home and your pet going forward, and then what we'd expect the typical outcomes to be. Currently we have 4 people, so myself and 3 technicians, who all work very well together to do our best to take care of the patient in both timely and professional manner. At EVS Surgery, we definitely try and keep abreast of all the new technology. I was just reading a case on near-infrared fluorescent imaging that can help us to determine what lymph nodes may be associated with a particular skin tumor. So we're looking at constructing a near-infrared camera system that can help us to better take care of those patients, to not only remove those tumors that we see, but also to help predict if we're going to see any lymphatic invasion, as well as spread to lymph nodes associated with those, which ultimately could give patients a better outcome. So that's probably the most cutting-edge thing that we're doing currently. Post-operative recovery in the hospital is very typically management of pain associated with injury and surgical procedures, as well as kind of typical monitoring and medical care, which can be specific to certain conditions, but also may just be, like I said, administration of pain medication, making sure that your dog or cat's stable until we feel like they're able to be treated adequately with oral medications and things that you can do at home. Get them back where they can be more comfortable in your care.